What happens during asbestos medical surveillance? If you are curious about what happens during asbestos medical surveillance, you are in the right place. This program is essential for workers who may be exposed to asbestos, a material known for causing serious lung diseases. It is especially important for those in high-risk jobs like logging, deep-sea fishing, and storm chasing, where asbestos exposure can occur due to old equipment or environmental conditions. The process begins with a review of the worker's medical and work history. Healthcare providers gather detailed information about any past exposure to asbestos and any symptoms related to the respiratory, cardiovascular, or digestive systems. This step is vital for identifying early signs of asbestos-related health issues. Next, workers complete a respiratory disease questionnaire. This standardized form focuses on respiratory symptoms and history, helping to detect any changes in lung function or early disease symptoms. A thorough physical examination follows, with special attention given to the lungs and chest area. This exam helps identify any physical signs of diseases related to asbestos exposure. One of the key components of the surveillance is a chest X-ray. This imaging test looks for abnormalities in the lungs and pleura, the lining of the lungs, that asbestos fibers can cause. Conditions like asbestosis, pleural plaques, or lung cancer can be detected through this method. Pulmonary function tests, specifically spirometry, are also conducted. This test measures lung capacity and airflow, focusing on forced vital capacity and forced expiratory volume in 1 second. It assesses how well the lungs are functioning and can reveal any impairment caused by asbestos exposure. Depending on the physician's judgment, additional tests may be performed. These could include blood work, computed tomography scans, or gas exchange measurements to further evaluate lung health. The frequency of these medical exams is typically at least once a year for workers exposed to asbestos above certain levels. More frequent exams may be necessary based on the intensity of exposure or recommendations from the physician. Exams are also conducted when employment ends. Another important aspect of the surveillance is determining if the worker can safely wear respiratory protective equipment. This is crucial in environments where asbestos exposure is a risk. Employers are required to maintain medical records for each exposed worker for at least 30 years after employment ends. This long-term health monitoring is essential since asbestos-related diseases can develop decades after exposure. For those in unusual or high-risk jobs, such as logging old structures or working on deep-sea fishing vessels with asbestos insulation, this medical surveillance is vital. It helps detect early signs of disease before symptoms become severe, allowing for timely intervention and protecting long-term health. In summary, asbestos medical surveillance is a structured health monitoring program focused on early detection of asbestos-related diseases through comprehensive assessments tailored to the worker's exposure risks.